causes cerebral palsy in today's video? What are its 10 symptoms? What causes brain stroke? What are its symptoms? A brain stroke, or cerebrovascular accident, CVA, occurs when the blood supply to a part of the brain is interrupted or reduced, preventing brain tissue from getting enough oxygen and nutrients. This can lead to the death of brain cells within minutes. There are two main types of stroke. Ischemic stroke. This is the most common type, accounting for about 87% of all strokes. It occurs when a blood clot blocks or narrows an artery leading to the brain. The blockage can be caused by, number 1, thrombosis, a blood clot that forms in one of the brain's arteries. Embolism, a blood clot or other debris that forms away from the brain, commonly in the heart, and is swept through the bloodstream to lodge in narrower brain arteries. Number 2, hemorrhagic stroke. This type occurs when a blood vessel in the brain bursts, leading to bleeding, hemorrhage, in or around the brain. Causes include aneurysm, a weakened blood vessel that bursts. Arteriovenous malformations, AVMs, abnormal tangles of blood vessels. High blood pressure, chronic hypertension can weaken blood vessel walls. Risk factors for stroke. Several risk factors can increase the likelihood of having a stroke, including high blood pressure. High blood pressure, or hypertension, is a major risk factor for stroke. When blood pressure is consistently high, it can damage the arteries, making them more prone to rupture or clogging, which can lead to a stroke. There are two primary types of strokes caused by high blood pressure: ischemic stroke and hemorrhagic stroke. Each type has distinct effects and potential complications. Strokes caused by high blood pressure can have severe. Effective management of high blood pressure, along with prompt treatment and comprehensive rehabilitation, is vital to reducing the risk of stroke and improving outcomes for stroke survivors. Heart disease. Strokes caused by heart disease can have devastating and wide-ranging effects on the body and mind. Heart disease increases the risk of both ischemic and hemorrhagic strokes. Understanding the types of strokes related to heart disease and their potential effects is crucial for recognizing symptoms, seeking timely treatment, and implementing preventive measures. Strokes caused by heart disease can have profound effects on physical, cognitive, and emotional health. Effective management of heart disease, along with prompt treatment and comprehensive rehabilitation, is vital to reducing the risk of stroke and improving outcomes for stroke survivors. If you or someone you know has heart disease, it is essential to work closely with healthcare providers to manage risk factors and maintain heart health. Diabetes. Diabetes significantly increases the risk of stroke, and when a stroke occurs in individuals with diabetes, it can lead to more severe outcomes and complications. The chronic high blood sugar levels associated with diabetes can damage blood vessels and nerves, contributing to the development of cardiovascular diseases, including stroke. Strokes caused by diabetes can have profound effects on physical, cognitive, and emotional health. Effective management of diabetes, along with prompt treatment and comprehensive rehabilitation, is vital to reducing the risk of stroke and improving outcomes for stroke survivors. If you or someone you know has diabetes, it is essential to work closely with healthcare providers to manage risk factors and maintain overall health. Smoking. Smoking is a major risk factor for stroke and can significantly worsen the effects of a stroke when it occurs. The chemicals in tobacco smoke can damage blood vessels, increase blood pressure, and contribute to the development of atherosclerosis, the buildup of plaque in the arteries, all of which elevate the risk of stroke. Here are the types of strokes linked to smoking and their effects. Strokes caused by smoking can have profound effects on physical, cognitive, and emotional health. Quitting smoking, managing risk factors, and engaging in comprehensive rehabilitation are vital to reducing the risk of stroke and improving outcomes for stroke survivors. If you or someone you know smokes, it is essential to seek help and take steps towards a healthier, smoke-free life. Obesity. Obesity is a significant risk factor for stroke, and when a stroke occurs in individuals who are obese, it can lead to more severe outcomes and complications. Obesity often contributes to other conditions such as hypertension, diabetes, and high cholesterol, which further increase the risk of stroke. Strokes caused by obesity can have profound effects on physical, cognitive, and emotional health. Effective management of obesity, along with prompt treatment and comprehensive rehabilitation, is vital to reducing the risk of stroke and improving outcomes for stroke survivors. If you or someone you know is struggling with obesity, it is essential to work closely with healthcare providers to manage risk factors and maintain overall health. High cholesterol. High cholesterol significantly increases the risk of stroke, and strokes that occur in individuals with high cholesterol can have severe consequences. Elevated cholesterol levels contribute to the development of atherosclerosis, where plaque builds up in the arteries, leading to reduced blood flow and increased risk of clot formation. Here are the types of strokes linked to high cholesterol and their effects. Strokes caused by high cholesterol can have profound effects on physical, cognitive, and emotional health. Effective management of cholesterol levels, along with prompt treatment and comprehensive rehabilitation, is vital to reducing the risk of stroke and improving outcomes for stroke survivors. If you or someone you know has high cholesterol, lack of physical activity. The effects of stroke due to a lack of physical activity can be profound and multifaceted, impacting physical, cognitive, and emotional well-being. A sedentary lifestyle significantly increases the risk of stroke by contributing to various health issues such as obesity, high blood pressure, diabetes, and high cholesterol. When a stroke occurs in someone who has been inactive, the outcomes can include excessive alcohol consumption. The effects of stroke due to a lack of physical activity can significantly impact an individual's recovery and quality of life. It is crucial for stroke survivors to engage in physical rehabilitation and adopt healthier lifestyles to mitigate risks and improve outcomes. Collaboration with healthcare providers to develop a tailored rehabilitation plan can enhance recovery and support long-term health. Age, risk increases with age. The risk of stroke increases significantly with age, and strokes that occur in older adults can have various effects due to the complexities of aging and the body's response to a stroke. As people age, their bodies undergo changes that can contribute to the likelihood of stroke, such as increased blood pressure, changes in blood vessels, and the accumulation of chronic health conditions. Here are the effects of stroke due to age. The effects of stroke due to age can be significant and multifaceted, leading to increased disability, cognitive decline, and social isolation. Effective management strategies focusing on prevention, rehabilitation, and support systems are essential for improving outcomes and enhancing the quality of life for older stroke survivors. It's vital for healthcare providers, families, and communities to work together to support older adults in managing their health and navigating the challenges of stroke recovery. Family history of stroke. A family history of stroke can significantly increase an individual's risk of experiencing a stroke themselves. Genetic predispositions, combined with shared lifestyle factors, can create a higher likelihood of stroke occurrence. Here are the effects of stroke in individuals with a family history of stroke. The effects of stroke in individuals with a family history of stroke can be extensive and multifaceted, leading to increased disability, cognitive decline, and social isolation. Understanding the genetic and lifestyle factors that contribute to stroke risk is essential for effective management and prevention. Collaboration with healthcare providers, family members, and community resources can support individuals at risk for stroke and improve recovery outcomes. Symptoms of brain stroke. The symptoms of a brain stroke can vary depending on the type of stroke, ischemic or hemorrhagic, and the area of the brain affected. Recognizing these symptoms is crucial for timely medical intervention, which can significantly affect the outcomes. Here are the effects and implications of stroke based on common symptoms. The effects of stroke due to its symptoms can be extensive and life-altering. Early recognition and treatment are vital for minimizing damage and improving recovery outcomes. A comprehensive rehabilitation program, including physical, occupational, and speech therapy, along with emotional and psychological support, is essential for stroke survivors to regain function and improve their quality of life. Let's find out exactly. The acronym F.A.S.T is a helpful way to remember the sudden signs of stroke. Number 1. Face drooping. One side of the face may droop or feel numb. Ask the person to smile. If the smile is uneven, it could indicate a stroke. Number 2. Arm weakness. One arm may become weak or numb. Ask the person to raise both arms. If one drifts downward, it could indicate a stroke. Number 3. Speech difficulty. Speech may be slurred, or the person may be unable to speak or be difficult to understand. Ask the person to repeat a simple sentence. Number 4. Time to go to hospital. If you have any of these symptoms, call emergency services immediately. Number 5. Sudden numbness or weakness, particularly on one side of the body, affecting the face, arm, or leg. Number 6. Sudden confusion, trouble understanding or speaking. Number 7. Sudden trouble seeing, in one or both eyes. Number 8. Sudden trouble walking, dizziness, loss of balance, or lack of coordination. Number 9. Sudden severe headache, often described as the worst headache of one's life, without a known cause. Number 10. Sudden difficulty swallowing, known as dysphagia. Immediate action. If you or someone else exhibits any of these symptoms, it is crucial to seek emergency medical attention immediately. Timely treatment can significantly improve outcomes and reduce the risk of long-term disability. Who haven't subscribed to our channel before, then please subscribe and encourage. Share this post with your friends. If you like this video recording, share your views in the comment box.